Welcome to the module Part 2, Key ABDM Components. In this module, you will learn about the remaining key components of ABDM. At the end of this learning module, you will be able to understand Health Information Exchange and Consent Manager, HIE-CM, or simply Consent Manager. Understand Unified Health Interface, UHI. Understand the importance of the ABDM Digital Health Partner Ecosystem. Let's get started. The Consent Manager plays a key role in linking the health record of a patient with doctors and medical facilities in a secure manner. The Consent Manager is designed to work on any ABDM-enabled software application, like Arogya Setu, to connect to the Aabha account. When Rahul uses Arogya Setu to share his health record with a healthcare facility, the Consent Manager will send him an OTP for validation, fetch records from Health Information Provider, HIP, and show them to the Health Information User, HIU. This ensures that the health record is shared securely. Rahul, for each of his health records linked with Aabha, can determine the facility and duration for which access to be provided. He can remove access to any of his health records at any time by revoking his consent. You must be wondering who are HIP and HIU. Let's understand this. Pursuant to consultation with Dr. Rashid for fever, Rahul got his tests done at ABC Labs. ABC Labs requests for prescription which Rahul shares by approving on Arogya Setu app. Once the tests are done, Dr. Rashid, through his hospital management information system, sends requests to Rahul for reports of ABC Labs, which Rahul approves. In this case, Dr. Rashid is Health Information Provider or HIP for his prescription and Health Information User or HIU for lab reports, as he is the creator of prescription and user of report. Let's now learn about the last key component of ABDM, the Unified Health Interface, UHI. UHI is an interface for interoperability, allowing different applications to interact and exchange information. Let's understand it with an example. Rahul wants to get his mother's painful knee checked. He finds that the specialized doctor whom he regularly visits is unavailable for another 2 days. So, he browses through commonly used health apps to book an appointment at his convenience and to avoid long waiting times. He finds another specialized and verified doctor through one of the apps, but the doctor's clinic is too far from his house. He then explores another app that shows the immediate availability of the doctor, but finds the consultation fee too high. With two different apps, Rahul experiences two different situations. Also, he had to switch between the two apps to find the verified doctor who is available at his convenience and budget. He then uses the UHI-enabled health app. He gets easy access to a long list of specialized and verified doctors from different applications, with consultation fees mentioned in one single app instead of hopping from one app to another. Thus, the doctor and patient doesn't need to use the same application to be able to talk to each other. Using the UHI-enabled app, he can now book his mother's online appointment at his convenience of time, place and money through a single app. As in UPI, financial transactions are allowed from any one single app such as Paytm or Google Pay. UHI will allow patients to book an appointment with a doctor through any one app. Some of the benefits of UHI for doctors are listed here. Easy discoverability. Registration on different health apps will not be required and will be available in more searches. Ease of doing business. More visibility, discoverability, and authenticity will support ease of doing business. In summary, Unified Health Interface (UHI) will ensure interoperability and lead to accessible healthcare. Let us now understand the ABDM digital health ecosystem partners that include different healthcare software or application providers. But before we move ahead, let's ask a quick question. Do you know the reason behind the very high success rate of the Google Android platform? The answer is the thousands of mobile software products that have been built on it. In today's digital world, the value of any platform depends heavily on the number of applications which use the platform. In India, the success of the UPI payment gateway is largely due to the number of finance and e-commerce applications which have integrated with the UPI payment gateway. Similarly, for ABDM, hundreds of healthcare software applications are being integrated with ABDM and joining the ABDM digital health ecosystem. Once a healthcare application becomes ABDM-enabled, it can seamlessly exchange information with other ABDM-enabled applications. For example, an ABDM-enabled lab management information system (LMIS) can share patient data with ABDM-enabled health management information system (HMIS) of a hospital with the patient's consent. As you can imagine, when hundreds of applications are engaging with each other in a seamless manner using ABDM, it results in substantial simplification and benefits to everyone in healthcare, similar to what we have seen in Aadhaar and UPI. In summary, we can see that an ABHA of a patient and HPID for a doctor, coupled with the consent manager and UHI and digital health partner ecosystem, can completely transform healthcare. Let us summarize the points covered in this module. The consent manager enables individuals to control who can have access to their health records. UHI helps individuals access healthcare services and book appointments. ABDM-enabled software applications help seamless exchange of health information. Let's see how all this is significantly benefiting doctors and hospitals in the next section. For more information on ABDM, visit the ABDM website and follow us on our social media handles.